Pat in Bellevue, Washington. Hey, Pat, what's up?
Well, I want to suggest that one thing I'd like Biden to do and change is the rule of using income of your savings are calculated as income. So it happens to less well-off widows. They've spent their last savings to treat their husbands. They die. 2 years later, they suddenly find that their Social Security has gone down by hundreds of dollars. And it's all because the savings were counted as income.
Right. Yeah, I agree with you. We need to change the way that Social Security eligibility is defined. The other thing that I think is crazy is that if you made a lot of money during your lifetime, you get a fair amount of, a pretty healthy Social Security check. A married couple can be getting over $4,000 a month in Social Security right now. And whereas, somebody who just, worked their butts off but never made more than, $30,000, $40,000 a year is going to be getting, less than $1,000 in Social Security a month when they retire. And I just think that's wrong. I think that needs to be that spread that rewards, wealthy workers and penalizes less wealthy workers, I think is wrong as well. But in particular, the penalty on widows. And I see this with my mother-in-law, my wife's mother, who's in her early 90s and doing just great. But, how do you live on those little amounts? It's a tough one. Pat, thank you. Spot on. Marilyn in Sun City West, Arizona. Hey, Marilyn, what's up?
Hey, Thom, thank you for all you do. You were talking, or somebody was talking about Ro Khanna's Bill 5010 that gets the waiver so that states can start their own health care. And once again, I am from Saskatchewan, so I appreciate you mentioning Tommy Douglas, because you are 100% right. Something people don't know, because they talk about the health care system and that the U.S. has the best health care in the world, and I'm not convinced of that. But if you are severely ill for anything, cancer, heart, whatever it is, in Canada, and there is a procedure available somewhere else in the world but not available in Canada, as long as it is a legitimate medical procedure and not experimental, the Canadian government will pay to have that operation in London or at Phoenix Children's or wherever that is. And I know that because my brother grew up in a hospital. He spent half his life in the Canadian hospitals and half his life at the Mayo Clinic in Minneapolis, because at that time it was the best hospital in the world. And my parents never paid a dime. Wow.
And the government of Canada, did they pay for the transportation as well to fly them to Minneapolis?
All of that. There's a little motel called Soldiers Field just outside of Minneapolis where the Mayo Clinic is, and they had accommodations there so they could stay near him. But yeah, they paid the whole, as long as it's referred, as long as you're referred by a doctor.
Right. That's amazing. Marilyn, I did not know that. Thank you for sharing that story with us.